Welcome to another episode of our In Conversation live sessions. Today we're in conversation with Dr. R.K. Bhardwaj, ENT and head and neck surgeon. Dr. R.K. Bhardwaj has been practicing for over 29 years and has also most recently been awarded the title of Best ENT Specialist of Delhi in 2020. We're very glad that Dr. R.K. Bhardwaj has joined us here to talk about sailing through seasonal allergies. With 29 years of experience, Dr. Bhardwaj has, it is no surprise, of course, that people all over the country and all of all ages approach him for their day-to-day discomforts and troubles. Thank you so much for joining us today, Dr. R.K. Bhardwaj.
Thank you, Sakshi. Thank you for having me here on this session. Um, I'm grateful to you.
Thank you, sir, for that. So, to begin with, sir, we have a few questions and then we will be taking up audience questions as and when they come up. Dr. R.K. Bhardwaj, to begin with, we have been seeing a lot of cases of viral fever accompanied by cold and cough, of late. Is there any relation with, say, any strain of COVID, perhaps, or would you think that it's just a seasonal thing?
One point that you brought up because this is actually the so-called flu season. In the flu season, traditionally, historically, at this time of the year, we do see patients coming down with the flu, which is basically influenza. The influenza is most commonly caused by virus, and the virus is usually a rhinovirus and other respiratory disease viruses. This disease or this so-called influenza or seasonal flu has been in existence for years together, and this is the time of the year that it happens. The surprising part is that last year we did not see so many cases, maybe because of certain restrictions and strict lockdown measures. But this year we have gradually started seeing cases of seasonal flu. So if you have a cold with fever, you have the typical symptoms of flu, especially if it's associated with cough. Initially, because of the very, very dreadful second wave, we again thought that we are dealing with more and more cases of COVID 19. But fortunately, on testing them, we found out that they were RT-PCR negative for coronavirus. And then subsequently, when it dawned upon us that this was back to the old days of the seasonal flu, when we tested them for H1N1 and H3N2, we found that they were positive for these viruses. And so we finally came to a conclusion that we are back in the flu season. These patients are suffering from a seasonal flu, and traditional treatment, just simple symptomatic measurement, is all that they require. And this is not COVID 19.
All right. I think that's very reassuring for many of us to know that most of these cases are not COVID-19. So, doctor, in that respect, then if we move a little towards the point of vaccination, I think you've mentioned previously sometimes that people should be encouraged to take the flu vaccine. But with respect to the COVID vaccine, also, are these two vaccines sort of interchangeable in any way? Like, say, for example, would the flu vaccine maybe put you at maybe somehow protect you from getting COVID or vice versa?
So let me answer this in a wider context, actually, so that people understand basically the requirement and need for vaccination and what they need to do. First of all, for the coronavirus, the two doses of vaccine, whether it's Covaxin or Covishield or the Sputnik also that is now available for people to use, that is all that you need to use for coronavirus. And it offers you, if, we have enough evidence to know that it offers you sufficient immunity against catching a serious form of the disease, as well as to reduce hospitalization and also reduce drastically any mortality arising out of this infection. The flu virus is different. It's a different strain or a virus itself. And so, obviously, the immunity that the vaccine for COVID 19 or coronavirus gives you is not the same as a flu vaccine gives you. So, these are two different vaccines. And to clarify it further, for the last many years, we have been using flu vaccine on the vulnerable population, specifically children between 2 and 6 years of age, and those who are 70 years and above, and those who are elderly and also have comorbidities like respiratory diseases or diabetics, especially those who had community acquired pneumonia in the previous winter. These were considered candidates for the annual flu vaccine. This year, and this is a recommendation that has come from many health governing and healthcare bodies, this year, because of the presence of the pandemic, we are making a general recommendation that we should get the flu vaccine. The current flu vaccine for the season 21-22 is available from various different companies because the virus strain has been identified. We are recommending, just to keep you safe during this present time, we are recommending that you take the flu vaccine, not for getting immunity against coronavirus or COVID 19, but to get immunity against the seasonal flu, because of which you will not get the flu and your body's immunity will not go down. So, the concept here is that if you catch the seasonal flu, your immunity goes down and that makes you more prone to developing COVID 19. That's the basic philosophy. There may be some cross reaction or immune advantages, but we are not doing it for that purpose.
All right, I think you've brought up some important points that we should keep in mind for sure. So, like you said, it is recommended that people take the flu vaccine and, of course, the COVID vaccine as well. So, we have actually gotten a few questions already. I will take up a few of these now. So, there is a question from Prashant. He says, how do we counsel parents of allergic rhinitis children? So, basically, children with allergic rhinitis. What are the preventive measures that we can ask them to take? And also, if you could maybe talk a little bit about the role of the air purifier in preventing allergies.
For your question. Good afternoon, Dr. Prashant. Thank you for your question. These are important questions because, as you and I have seen over a period of time, the percentage of children with allergies has increased tremendously in the last about 30-40 years that we've been practicing here. Initially, if you remember, it was maybe one child out of 10 would have symptoms of allergy, including nasobronchial allergies and bronchial asthma. And now the current percentage is at least 3.5 out of 10. So more than 30% children are suffering from some kind of allergy or the other, and that number is probably going to be on the rise. So obviously we have to be very vigilant and careful about symptoms of allergy in children. Earlier, we were basically just treating them for adenoids and infections and tonsillitis, but the incidence of allergies has definitely gone up, and we need to be careful. So there are certain things that we want to do. First of all, we want to find out what is it that they're allergic to. If we don't want to do a specific allergen test to find out what are they allergic to, we can have broad guidelines depending upon at what time of the year the child falls sick or what kind of symptoms they have, and depending upon that we can counsel the child as well as the parents. The most important thing is avoidance, and there are, in this instance also, there are some difficult decisions that the parents and the child may have to make. And in this, I'm specifically talking about furry animals. Furry animals are definitely a source of allergy for children as well as for adults. And sometimes it is an emotional issue because the animal is so attached to the family that they may find it difficult to part ways. So we have to deal with this, counsel them, and tell them the various issues that could be leading to an allergic scenario in the household as well as outside, and try and bring them out so that the child suffers the least minimum. The role of air purifiers is very clearly built. There is a slight dilemma here as far as you and I are concerned in giving clear instructions to our parents as well as other lay persons. The problem with that is that removing allergies related to bad air quality and dust pollution is in direct contravention to the advice that we are giving for COVID 19. For COVID 19, we want you to keep your doors and windows open to ventilate your home so that the virus passes through and does not rest on any surface, or stay in the house as droplet or aerosol. But for air quality, our general recommendation has been keep your doors and windows closed. In the room in which you spend the most amount of time, make sure that you have a good air purifier, an air purifier that is usually of a higher caliber than the one for your room. For instance, if the air purifier is for a room of 120 to 150 square feet, then make sure that the room size is slightly smaller than that so that your air purifier is efficient. Make sure that you clean the filters of the air purifier frequently. The newer generation air purifiers actually can work through an app. They tell you about the air quality in a real time manner, and you can definitely monitor the air quality in the room. Try to remove flowering plants and strong smelling substances from the child's room, and Again, another slightly emotional or a little issue is the dhoop battis and agarbattis sometimes that we have a habit of lighting up in our homes. We must understand that for children and adults who have an allergic predisposition, the strong smell and smoke associated with these activities may be a little harmful for the children.
All right, so I think those were many different points that you covered and that are essential for people to know, not only doctors, but also for the lay audience to know. So we have another question from Rohan. He says, hello, I have psoriasis. How do I cure it? And do you have seasonal flare ups? What is causing it?
So, Sakshi, I'm an ENT specialist. I'm afraid I'm not the right person for this. But Rohan, psoriasis is, yes, there are seasonal flare ups. There are flare ups related to stress and strain. And, but fortunately, there is enough treatment available for psoriasis, local as well as systemic treatment. I'm sure you would be well advised to attend with a good dermatologist who can definitely keep your skin condition under control.
All right, sir. So there is another question from Aman. He says, can you please suggest some do's and don'ts for people with seasonal allergies?
Aman, thank you for joining us. It's an interesting and important question because people would like to know. And Sakshi, if you know, in our list of questions, also we have this listed. So we can actually take this up right now because you also wanted to know and we wanted to inform our viewers what are the time of seasonal allergies. If you remember, we have that question listed. So we can address that along with this question that Aman has asked us. Seasonal allergies typically happen in the month of March, April, and October, November, what we call holy time and Dashera time. That's when the season is changing. Seasonal allergies are usually related to in the autumn season. They're related to the fact that air quality is going down, the air is becoming dry, smoke and dust and air pollutants increase. In the springtime, we are worried about pollen, we are worried about strong smells, we are worried about flowering plants, and so there are different reasons at different times of the year which cause seasonal allergies. The thing with seasonal allergies is that they're easy to diagnose because patients come specifically with a symptom. डॉक्टर साहब हर 4 अप्रैल को मेरे को छींक आनी शुरू हो जाती है. So we know at that moment that there is something happening over there, some flowering plant or some pollen which is disturbing the patient, and we need to find out, be vigilant, and ask the person to avoid that particular thing so that the seasonal allergy goes away. Seasonal allergies are usually easier to treat than perennial allergies, and when we treat seasonal allergies, the results are usually gratifying, and patients generally do well. There is also a possibility that if the patient is really keen, we can test them to find out what is going on. And the test is done at a two-level thing. At the primary level, we do a CBC and IgE to find out about the patient's response in the body to outside allergens. If the IgE is elevated, we then go ahead and do what we call a specific allergen test for either for rhinitis, which is nasal allergies, or for asthma, which is related to the lungs, or we do a comprehensive allergy assay to find out what are the inhalants to which the patient is allergic so that we can start avoidance measures. And that is the best way of treating allergies.
All right, sir. So actually, you did answer a few questions, a few other questions that we had as well in terms of the time, the season, if there is any particular month or few months that allergies occur during. There is also another question of whether there are any specific allergies that you have come across. Maybe, like you said, Holi and Dashera, but what about now at this point in time? Any specific allergies that, you would want people to know about, whether it's related to the ear, nose, or throat, or anything in general?
There is, so this is basically, we are coming to the end of the monsoon season. The end of the monsoon season is basically, we are related to activities of humidity. There is a small subset of people, humans, who are allergic to humidity. Most of us tolerate humidity well. In fact, we recommend a humid environment for the nasal mucosa, mucociliary clearance, as well as for the lungs to function efficiently. But there is a small subset of us who has a definite problem with humidity. So maybe out of a group of 100, about between 5 and 10% will come to the doctor with symptoms of allergy because they don't do well because of the high humid levels in the environment. And here we have to basically treat this with medication. and also with a little local environmental treatment so that they become more comfortable. In this instance, one of the things that we want to tell them is to look for sealant. Sealant is the seepage that happens in our houses, particularly if you're in multi-storied apartments and some water from above you is leaking. That causes seepage into your walls. The seepage into your walls makes your walls wet. The problem with a wet wall is that as soon as the wall becomes wet, particularly in this season, fungus grows on it. And mold is one of the things, this one of the second or third commonest substance to which humans are allergic is mold. And mold grows on these wet walls, and the humid season, particularly because of the high rainfall and because some of our houses may not have been built to tackle this kind of an outflow, sometimes water seeps into the walls, causes seepage. The seepage causes growth of mold or fungus, and many of us are allergic to that. So we should be careful, particularly in this season, related to appearance of mold on our walls.
All right. That is a pertinent point as well. Mold is something that I think a lot of us might have seen in terms of seepage, particularly in the season. So we have a few other questions. There is a question from Dr. Pancham. She says, which of the drugs is better as there are many options available, Allegra or LCZ or Desloratadine? Please suggest.
So, Dr. Pancham, antihistamines have been in existence for the last more than 50 to 60 years. We have had first generation, second generation, third generation antihistamines. The ones that we are currently prescribing now are third generation antihistamines. The advantage of a third generation antihistamine is that they are non drowsy, so that they don't cross the blood brain barrier so well. And because they don't cross the blood brain barrier, they don't cause so much of uh, sleepiness or drowsiness or motor incoordination. The choice of antihistamine, as we've learned over a period of time, is quite often personal. So, if we have seen that if fexofenadine works in one person, it may not work in the other person. Some persons do very well with desloratadine, they don't do very well with fexofenadine. It is, at the end of the day, quite a mix and match depending upon patient's individual susceptibility to an antihistamine. Having said that, even now with the non sleep inducing or non drowsy antihistamines, there are still some patients who complain of drowsiness, and sometimes we have to change their antihistamine, though it is labeled as non drowsy, so that the patient is more comfortable. Bilastine is also now available. Now, bilastine works for the minimum duration of 24 hours, so that is also another antihistamine that is available. The other thing I want to inform you is that if the patient's symptom is mainly nasal, we have found out that as monotherapy, intranasal steroid has a much better profile. It improves symptomatology to a much better extent than even an oral medication. So I would recommend that if patients' allergy symptoms are mainly in the nose, we should rely more on an intranasal treatment, particularly an intranasal steroid whose safety profile has been well built in, rather than giving systemic medication, which by themselves have their own side effects. And the intranasal steroid can be used for a period of 3 to 4 weeks as a clinician for you at a time. But please tell your patients not to self-medicate, which is a habit that many of our patients have. And I get patients sometimes who have been taking these medications for years together with many side effects. So, for limited periods of time, I would recommend for a patient who has purely nasal allergies to rely on monotherapy with intranasal treatment if necessary. And if the patient has other systemic symptoms related to allergy like itching, rashes, or watering of the eyes, you may like to add a systemic antihistamine.
All right, sir. Sir, that was from a clinical perspective. If you talk about it from a non-clinical perspective, in the sense for a general audience, like you said previously, we might have to do a few tests and everything for different allergies. But are there any suggestions broadly that you would like to give when it comes to treating certain allergies?
So, see, now the treatment of allergy actually works in two ways. First is allergen avoidance, which is the most important thing. In allergen avoidance, if we have realized what all are we allergic to, and I believe most patients who've been dealing with allergies, over a period of time, learn to figure out what is it that is causing them. It may be some strong smells in the kitchen. It may be the furry animal or a pet that they've got. It could be some flowering plant in the house. It could be a seasonal change when they know that they will fall sick. So, whatever it is that they can do to avoid that particular situation, whether it's a dusty environment or a polluted environment or a smell or a pollen, they should try and do that. They should keep their doors and windows closed so that outside pollutants and things that they're allergic to from the outside environment do not invade the house, and invest in a good air purifier so that the room, at least in which they spend the most amount of time, remains clean. As far as treatment is concerned, treatment is fairly effective and safe, and it can either be in the form of oral medicines or it could be in the form of some local treatment. But I think it would be better if the doctor decides this. The good news in this is that there is also now immunotherapy that is round the corner. It is already introduced in other countries. It is gradually coming into our country also. It may take another year or two. And initially it started off by giving injections, but now oral treatment called sublingual immunotherapy is now probably going to be the mainstay of treatment for patients with allergies, especially if they have a single allergen allergy, in which case we make some compound from that allergen and desensitize the patient's body to that allergen so that the patient does not then ever need to take medication for the allergies. This is round the corner. In the next 2 to 3 years, 1 to 2 years, I'm sure it will be available for our patients.
All right, that's something for us all to look forward to. And like you already said, I would also like to reiterate for the audience that don't self-medicate. That is probably not a good thing and could probably make maybe perhaps worsen your condition. So it's always better to approach a doctor first and talk to them and see what it is that they actually advise. So with respect to the treatment now, there are a few people, actually quite a few people, I think, who often ask about home remedies. So whether it's a nasal congestion or maybe throat, like a sore throat or anything, are there any tips or anything that you would like to share with respect to home remedies? What can people actually do at home to sort of ease their symptoms?
So that's another important consideration because home remedies should form, particularly for chronic illnesses, home remedies should form an important part of our treatment regimen. For the nose, throat, lungs, the commonest organs that suffer from allergies, there are some things that we can do. The number one thing we can do is saline gargles. Saline gargles are safe and effective in treating throat allergies. So if you have gone out and you were in an environment that was extremely polluted, you come back home and your throat is itchy and scratchy, or you've eaten something that didn't agree with you, or the food that you had was a little oily or spicy, and the spices are something you were allergic to, you should definitely just gargle with a warm saline, half a glass of warm water with half a teaspoon of salt, and you can gargle maybe once or twice a day. That is a very good home remedy to take. The second home remedy that we advise, particularly for people who have nose and lung problem, is to take a steam inhalation. Now, in steam inhalation, sometimes the questions that are asked is, should we put eucalyptus oil? Should we put some other strong smelling substance in that? So you must understand that it's the steam that works. The steam basically works by getting into the mucus plug. It loosens the stickiness of a mucus plug and makes it easier for the body to take it out. That's how steam works. Anything else that you put is a flavoring agent. It is not performing any useful function. The useful function is only of the steam. Steam inhalation also we would advise you to do once or maybe twice a day. And in this present context, Sakshi, I will take this opportunity to inform our viewers about what they should not be doing. And this we've learned over a period of time, and specifically, very, very suddenly, over a short period of time, we learned during the COVID 19 pandemic. And there were so many home remedies which people were going in for, which were so harmful for them. And let me list them out for you. One is, somewhere down the line, it was that if you take something hot, it kills the virus. People were doing steam inhalation with hot steaming water every hour with the hope that they would keep the virus away. It is not advised that hot steam in excess is harmful for your body. It's harmful for your lungs and nasal passage. It kills cells. It is very harmful for your skin, and your skin may break up into spots. So We do not recommend that you do this all through the day. Once or twice a day is all that you need. The second thing that people were doing were related to their throat. In an era when most of us have stopped eating spicy food, we were adding all kinds of spices to our water and drinking them, known as kadha, with all, from cinnamon to cardamom to all kinds of other, to ginger and turmeric and all kinds of things in excess we were adding and adding them in hot boiling water, with the result that I had so many patients coming to me with ulcers in their mouth related to home remedies. So that is something which is not acceptable. That is something we don't want to do. Home remedy should be a simple, gentle passage which should help us to keep ourselves safe, but not done in such a drastic manner that it leads to causing a problem rather than helping us in any way. All this doing drinking kadha or hot water, boiling water, or doing steam inhalation every hour is not effective against killing or getting rid of the virus. If you have some specific symptoms for which you need to do this, you may do so, but make sure that your concoction that you're making is not very spicy, because that by itself can damage your throat. And make sure that it's not so hot that your oral mucosa cannot tolerate the heat. So these things also we have to, balance out, to know that some things are acceptable, some things are helpful and useful, but we cannot overdo these things to an extent that we harm our bodies.
All right, so those were very, interesting discoveries that you sort of talked about right now with respect to mouth ulcers being caused by extremely hot liquids that you, saw many cases of. Sir, if you could also talk a little bit about ear infections that that you might be seeing at this point in time with respect to the monsoons, and how we could maybe protect ourselves against them.
This is the time of the year for ear infection. So, because of the humidity and because sometimes of the wax in the ear, though not so much, some swimming pools have opened. I've started particularly for people who've been going to the Maldives or Goa, or in certain areas where swimming pools have opened. People have started coming to me now because of swimming related ear infections, which is what we expect to see at this time of the year, because the water goes into the ear because of ambient humidity levels. The wax in the ear swells up. There may be certain infections related to water going inside. Overall, we call these things swimmer's ear. A swimmer's ear is usually something we see in the humid season, and it is basically related to an infection in the external ear. It's quite painful, and quite often we see evidence of fungus. And so the treatment for that would be to remove all these fungal particles, and maybe sometimes, if required, to put a small dressing. And so local treatment by and large is all that is necessary to do. And we have to be careful about not letting water go into the ear, particularly at this time of the year. And for our viewers who are swimming or have or may intend to go for a swim, try and put earplugs, anything that you can get from a sports shop or you can buy online. Put some earplugs so that water doesn't go into your ears and you don't get an ear infection. I would also like this opportunity to inform our viewers that using earbuds to try and clean your ears is not recommended. It has never been recommended. No medical authority recommends it. It is a habit that can get you more often into trouble. It never really helps you in any manner, because the physics of it is very simple. If you have wax in the ear and you blindly put in an earbud or anything else that is handy, all you will do is push that wax inside into a deeper part of the ear canal, and may also more likely infect the ear canal. So we don't recommend that we use earbuds or Q-tips to clean our ears, because that is a harmful activity.
All right, so I think that's again another useful piece of information that you just shared, because I don't think many of us did know about this. So we have a few other questions. Also another question that we were going to ask you was about precautions with respect to children that you might recommend. You have already spoken about allergen avoidance specifically for children with allergies. There is another question that we have from Minnie Kuti. And she says the same thing about precautions that you might want to suggest for children with seasonal allergies. If you could maybe just talk about maybe one or two key points.
Children with seasonal allergies basically need to keep away from an allergen if that has been recognized. Again, we go back to things that are commonly smoke, dust, maybe a furry animal if strong smelling plants, and also some outside environment. So try to make sure that if your child is going out, do not take them out to polluted areas. So there are certain hotspots. We know where are the hotspots. You know where are the polluted areas. So try to keep your child in as safe and clean environment as possible. And if the child sleeps in your room, then definitely in that room. Or if the child sleeps separately and independently by herself, make sure that you use an air purifier so that the child's environment is safe and clean. In the winter months, we also recommend sometimes to use humidification, because humidification helps children to breathe better and helps to clear up all the mucus that has entrapped all the dirty particles. It helps them to clear up all that in a more efficient way. So humidity or humidification helps children, and staying away from allergens helps them. And cleaning up their room with some kind of an air purifier would be a good idea for a child with allergies, especially if the child has a cough.
All right, so again, that was something for all parents to take note of. So there is one question from Akhil. He says, "Sir, मेरे भाई को 2 हफ्ते से खांसी हो रही है और हल्का सर दर्द भी रह रहा है। क्या ये कोई एलर्जी है या कुछ और?"
We had this discussion. I'll request if personal ailments are. This is an informative presentation. We are trying to inform our viewers. This cannot be taken for consultation because it is not the platform for it. And sometimes we don't have enough information to guide the patient. All I can tell people who are asking for personal problems related to their disease processes is that they must try and seek medical help, and that would be their best opportunity, because it's very difficult to answer or give justice to a consultation process in a program that is largely meant for educating.
All right, so that's fair. So there is one last question that we have from Vasu. He says, "Does a person having allergy from dust are they more likely to have seasonal allergies too, and anything that can be done about them?"
So dust allergy is all pervasive. In fact, many of us, if I am also exposed to some sudden dust storm, I will also maybe sneeze and have a nasal discharge, because dust has a habit of getting into your nasal passages. It disturbs the nasociliary mucosal blanket and leads to certain reactions like sneezing and watery discharge from the nose. So dust allergy does exist. It is very, very common. Seasonal allergies are different because they are related to certain items in the environment to which a person may be allergic. They are usually pollen, they are usually related to plants, and that is where we try to look for and find out what is it specifically that the patient is allergic to. Fortunately for us, in the presence of the pandemic, because we go out wearing a mask, a lot of incidence of dust allergy has gone away. In fact, if you remember, our earlier recommendation, even before COVID 19 struck us, was that in bad air days, please wear masks when you go out, because a mask will prevent you from gathering dust in your nasal passage and throat. So, because we are already masked up when we go out, dust allergies definitely are on a low incidence right now, and hopefully they will remain like that because we will continue to be masked for quite some time in the future.
All right, so I think that was a very helpful discussion. So if there is anything else that you would like to add?
See, the present situation, apart from allergies, is also always in people's minds is this the difference between allergy symptoms, common cold and flu, and COVID 19. Because the initial symptom starts off commonly nasal discharge, runny nose, little nasal stuffiness. Now, as long as you have just clear watery nasal discharge and sneezing and maybe a little nasal itching, these are typical symptoms of allergy or allergic rhinitis. If you have fever, along with the fever, you have a cold or a cough, this is a typical seasonal flu, because the fever has come in, there is a bit of a cold, and there is some cough. So we look at this as an seasonal flu. If you have body ache, lethargy, loss of sense of smell, loss of sense of taste, medium grade fever, lack and inability to want to perform simple tasks, and leading to a cough with a possible history of exposure to a patient who could be COVID 19 positive, we must then more seriously look to this person as having COVID-19, maybe do an RT-PCR to find out and confirm the diagnosis.
That was quite a clear for sharing those thoughts with us. And thank you so much, sir. I think you've really highlighted quite a few different points that that might have occurred at some point in time in someone's mind, and they didn't have a chance to sort of bring it up. Especially, I think one point I liked that you mentioned was about mask fatigue. Some people have this thing of it's a lot of. I mean, we've been wearing a mask since very long, and we don't need to wear a mask anymore. But actually, what you brought up and what you highlighted was that wearing a mask does have multiple different benefits, not only protecting yourself from COVID, but also in terms of dust allergies. So those are again things that we need to keep in mind for sure. Thank you so much, Dr. Bharadwaj, for joining us, and I hope we will have more such discussions with you in the future.
Thank you so much, Sakshi. Thank you so much. It was a pleasure to be here.
Thank you.